Hi everyone, welcome back to ADC Aspirants. I get a lot of inquiries from overseas dentists. They ask me, is it the right decision to move to Australia? Is it all worth it or not? Well, let me tell you, whether you're a young new graduate or a seasoned practitioner, the reasons for you to move to Australia as a dentist should be best known to you, right? But I've got something special for you today. We're going to have a heart-to-heart conversation with one of our ADC aspirants. Yes, Dr. Shashank Bhatia. He had been running a successful private practice back in India for a very long time, and he decided to dive right into the ADC journey. Did it work out? Of course it did. He's now an Australian registered dental practitioner. You are going to hear all about his story, his struggles, his experiences with the entire ADC exam journey. I sincerely hope this video helps you in some or the other way possible. So without wasting any more time, let's get into it. Hi, Dr. Shashank. I am so privileged and honored that you took out your time from your schedule and agreed to do this conversation with me today. For all of you watching us, first of all, my name is Dr. Henna and I'm the founder of ADC Aspirants. And I am thrilled beyond excitement to have my first ever conversation with somebody who has gone through the entire Australian Dental Council examination process and, who can talk about their experiences, their struggles, and also the high, points that have been there throughout their journey. And who better than you to start, our conversation with Dr. Shashank? It's like I've known you for so many years.
Yes,
so great.
true. Thank you, Dr. Henna, for having me here. It's a good platform for the young aspirants, ADC aspirants, to know more about the journey, and also, just it will kick them a bit more to start with the journey and just go through the process.
Exactly.
And
Absolutely. That's the entire point. So, Dr. Shashank, we'll begin with, you talking about yourself because I know I can go on and on. You have so many achievements behind you and so many more to come, I'm sure. Please tell us a bit about yourself. When did you start? When did you graduate? Your everything.
all right. All right, Dr. Henna. So yes, I was a prosthodontist back in India, and I'm in Australia since last 1 year. It's been just over a few days since I landed in Australia and started working here. So I graduated from Manipal in 2010, and then I went ahead and did my master's in prosthodontics and implantology from GDC Trivandrum. Finished off in 2014, worked as a senior resident for a year in a government dental college, and then started my own practice, private practice, focusing more on the prosthodontics and the implantology. And I was doing pretty good in India, was lecturing.
You were doing very well. Let me tell everyone, he was one of the speakers. I don't know, he's not saying it, he's being modest, but you were one of the speakers for the Indian Dental Association as well.
Yes. So, yeah, I was kind of contented with my life in India, had everything. By God's grace. But yes, you are always in for newer challenges, want to, see where you see yourself in the near future. And that is how I pursued or started pursuing ADC as a journey.
Exactly. That was exactly my next question, which was going to be, how did someone like you who had it all, and I mean, if I can say so, because you had your own practice, and also you were you were teaching as well, and everything was going good. I'm not saying that people who give this exam have they're not doing well back in their countries. What motivated you to pick up the ADC journey or get into it, and how did it start?
So my wife has a sister here in Australia. So it's a funny story. She was always behind me to, think about our future in Australia.
There is always that family relative, isn't it?
Yeah. So she was always behind me, but back of your head, you're like, you graduated from a prestigious college, you went ahead and did your masters, and why should you now venture into something, into something which you're not very sure about? So 2014, 15, she was behind me, let's do it. And I was like, no, I've spent 3 years doing masters in a government setup, which
Oh,
is
so there
challenging
was
in
a
this.
no. There was a no earlier, was there?
There was a no. It was a big
Okay.
no earlier.
Wow.
So I told her I've worked my
Yeah.
way up,
Yeah.
and I've given my all in my career, so I wouldn't want to venture into a foreign territory for now.
Yeah.
I want to pursue as a specialist in India,
Sure.
and that is how the journey started. So it was a big no to start with. Back of the head, she always tried to convince me every now and then, see, they are having a good life there, we're still struggling. Initial phases like that.
Yes, of course.
Yeah, then 2018 I came as a tourist to Australia. Yeah, spent some 15, 20 days, and that is when a bit of the spark was ignited, but nothing concrete enough to take a decision. Okay, it went into a back burner once you're back in India. Started doing full mouth rehab cases again, implant practicing,
Exactly.
all the comprehensive implant cases, and you were like, no, you are happy and contented. You have your family, you have your support system back in India, and it took a back burner again.
Okay.
Fast forward to 2021, 2022, 20 COVID hit.
Yeah.
2021, unfortunately, I lost my dad,
Oh.
who was my biggest support system. And I was like, nah. Since my support system is not there in India, he was my biggest critique. And he was someone whom I could fall back to. And since I lost him, I was like, and the way things were moving during the second wave of COVID, it, the loss was personal, but I somehow thought, India could have done much better in terms of managing the COVID cases. And I was a bit let down because I used to boast around the way things were being managed in the country with respect to COVID. And it hit me really hard. So I wanted some kind of distraction, some kind of motivation or something to look forward to.
Okay.
And I don't know how Preeti suggested, my wife, she suggested, and my brother-in-law was like, why don't you think about pursuing a career elsewhere? Because I was shaken to the core and I needed some kind of distraction. So whatever was thrown at me, I was like, okay. So that is how things started. And it was in a very impulsive decision. One fine day, I was like, let's go somewhere else. I don't want to practice here. And for me, you nurtured a dream. um, your clinic, your career, everything was started from scratch. So giving that away was a big task for yourself, making yourself mentally
Ready.
uh,
Yeah.
ready to do or pursue into something which you were not very sure about
Yeah.
was a challenge in itself. But
Yes.
once I made up my mind, I wanted to do it. You were the biggest factor.
I have to talk about that. I will certainly, tell all our listeners about how the conversation we had. And when I spoke to you, I was like, in my mind, is he crazy? But I'll come to
Right.
that. But yes, I agree that each one of us have our own personal reasons. It was COVID,
Yes.
the loss of, unfortunately, the loss of your father. But COVID was a time when we had to, in retrospect, we thought about a lot of
Yeah.
things. So I think it
Yeah.
turned out well for you. Yeah, a blessing in
Yes.
disguise is what I would
True.
say.
And I would add a personal touch to it.
Yes.
My father was always there behind me, supporting me in everything, and he gave me the time is the biggest factor. Or as a parent, what you can give your kid the best is time. And I think in India that was lacking.
Yes.
You didn't have time when you are a busy clinician. The
Yeah.
only thing missing in your life is time for your family members. And COVID did teach you that, the most important factor is time. And in India, the friends and families, they always used to say, work harder. This is your prime age. You should work harder. Why are you taking so many vacations? Why are you taking time off? Why are you coming back home early?
Yeah.
They used to make you feel guilty as if you're doing something, a big crime, if you come back home at 7 o'clock rather than 10 o'clock at night when other people are still working, other
And
clinics
they
are
don't
still open.
realize that they are overworking and you're working
Yeah.
smart.
Yeah, true. So, I didn't want to feel guilty for
Yeah.
working less. I didn't want to feel guilty for spending more time with my family. And that is where I thought, moving to a place where there is a work life balance would, help me in the long run. would prevent me from exhausting and over burdening myself with work.
Absolutely. I think that's what each one of us with families, look forward to when we are married, when we have kids and things like that. We think of the next generation as well, which is not wrong.
Yeah.
Now, I will talk about the moment when I got a call from, I think, Dr. Preeti, your wife, and
Yes,
I
yes.
spoke to her first, and then I happened to have a word with you, and I said, 3 months. Are you sure you want to give the written examination in 3 months?
Yes.
But how did you find out about ADC aspirants, and what role have we played, in your career? I mean, ADC journey.
All right. So first thing first, I should credit Preeti for that. So Preeti was doing the background work because I was busy with the clinic, and uh, I had made up a decision that I want to give ADC now. I didn't know about the process. I didn't know about what kind of exams happen and when it happens and how it happens. What's the procedure? Nothing. I wasn't aware of anything. So Preeti was doing the background work, researching about it. I wasn't trying to do anything on social media because I didn't want people to know about it. That
Of course.
all right. So I was playing really discreet, and Preeti was doing all the background work. So when she was googling about ADC exams, she happened to see your webpage, and she was like, she got amazing reviews, and I will give her a call and I'll try to connect with her and see what she says about your. Preeti was not in favor of me, giving exam after a few months.
Yeah.
Because we didn't know anything, to be very honest.
Yeah.
We didn't know ABC as well of ADC.
Yes.
Okay, so she spoke to you and you were like, see, to be very honest, you need more time and it's a process.
Yes, I would want to give a disclaimer, big disclaimer to anyone who's listening. This is Dr. Shashank is an exception. Do not follow the same footsteps. Give yourself enough time, but please carry on.
Yeah, so I think it was probably mid-December. ADC had allowed us, our initial assessment didn't go through because it was COVID year.
Yeah.
And they gave us an opportunity to appear for the March exam.
Yeah.
And I wanted to encash on that opportunity.
Hmm.
Okay, so I registered myself for the March exam in December mid, and Preeti connected with you end of December. And I still remember Preeti told me, I asked her when I came back from the clinic, I asked her, did you speak to Dr. Henna? What did she say? She was like, she was not in favor of you appearing for the March exam. She was more inclined that you prepare well for the September exam. I was like, but she said one thing, that I want to speak to the candidate rather than you. And I remember talking to you over the call, and you were like, see, I can see that confidence in you. I would still say it is gamble, but you helped me a lot during that process, and I'm really indebted to you when it comes to the part one exam. You did really help me understand the basic concepts. What are they really looking for?
Yes.
And that is really important. It's not about mugging things up. It is about understanding what they are expecting out of you.
Yes.
And you have to rely on your basics and your in-depth knowledge of the subject to give the exam. What happens, what I have seen of late is people are trying to mug things up, and that is when they are failing in the exam, that they don't realize that ADC is trying to screen people so as to for them to practice here in Australia. They want you to be a safe dentist here in their country. So their filtering process is pretty straightforward.
Yeah. They want less lawsuits against dentists. And I say it very, very openly as well, because they're just safeguarding us as dentists in the end. So if you
True.
mess up after you clear your exam, if you after getting your license, that's even more chaotic in your mind. Like, let's just mess up before we get the license, and there's always an opportunity to become better. But thank you so much for your kind words, and you've been an exceptional candidate, I have to say this. In fact, people who call me and they ask me generally, how much time do we need, and we have a busy practice, or we are we are working part-time. I tell everyone 6 to 9 months is what you should be aiming at, and start believing in yourself, like, okay, I know I need this much time, instead of looking for such suggestions. So yes, that was about your your how do I put it, like your interaction with ADC aspirants. But the rest of the journey, I believe, it's a very, it's a graph that goes up and,
True.
down. So what's your journey been with the examination process right from the start till the end?
Uh, I'm blessed that way. Things moved really smoothly. It's a process in itself, and there are quite a lot of ups and downs. I did clear my part one in one go without any issues, all thanks to you. Part two as well, I appeared for it. And in the first attempt, unfortunately, I just missed out on one station. I
Yeah.
still don't know why, but
Yeah.
it didn't deter me, didn't demotivate me, didn't, and I made sure I'm not making any changes in the way I approach the exam. The the only station which I failed, I don't know the reason. I still don't know the reason. We did
Yeah, we spoke
do
about it in detail and we tried to figure out, but then
yeah
the
we
only option we have is to, just go back to it with greater
true
enthusiasm, right?
yeah. So we did brainstorm a lot, and I think the only factor which would have been was a bit less confidence in that particular station.
Okay.
Okay.
Mm.
And in the next attempt, that is what I changed. I was like, none of the stations,
Yeah,
I am putting my head down. It's like I will keep my head high. I'm a clinician here in the room,
absolutely.
and though they are the examiners, they are patients for me.
Absolutely.
Okay. And that is the approach I had in the exam. And fortunately, I cleared all the stations this time, the next
Yeah.
time, and
Yes.
I'm
It
practicing
was
here
a
as
it
a
was a beautiful result, to be honest, and I want you to talk about the motivation you had. You gave me that idea of, just putting that certificate with your name
yes.
while you were preparing. I want you to talk
Yeah.
about it, and the listeners can, listen to that.
Okay, so I truly believe in something called as manifestation. What you manifest is what you get. Okay, if you manifest negativity, that is what you get. So I have seen people who keep cribbing about the transparency of the exam.
Yeah.
They keep talking about how difficult the exam is, how difficult it is for them to pass, whether if you give your 100%, even then, are you ensured about passing? Now, to give a perspective of manifestation, first attempt, I missed one station, but back of the head, I was, I clinged on to that particular station even after coming back. I was like, it went well, it went really well. Oh, it was only this particular station which I'm a bit underconfident. All
Mm.
right. Uh, and I did speak about this particular station in a bit of negative tone, that the examiner was a bit rude and this and that. And
Yeah.
I kind of manifested that result.
Oh.
All right. I brought negativity to that particular
And we
station.
hear that a lot, like, oh, I
Yeah.
wasn't spoken to properly, and that person was rude and angry, but that's what they're doing. They're acting as
Yeah.
real
True.
life patients.
Real
That's
life patients.
not every patient is going to come in smiling and walk back smiling, right?
True, true, true. So the second time, I manifested the results that if I'm not passing, I don't know who will pass. It's not, I'm not being, boastful. It was like
Yeah.
I wanted to give myself that confidence that it is not a difficult exam to pass. You have to be a clinician
Yeah.
whom they would want to come to their country with open hearts
Yeah.
and open arms. All right.
Yeah.
So I manifested that. And second time when I came back from the exam, it went well. I
Mhm.
knew it.
Mhm.
Um, though there were episodes where, things didn't go my way, I tried to, make it work my way.
Yeah.
But one thing I ensured, I didn't talk in a negative tone about this particular exam. Didn't tell anyone that this exam, this is what happened during the exam.
Yes.
So, for example, during one of the tasks on the technical day, there was a big, not goof up. There was a incident which happened when I was trying to give a depth cut in one of the tooth before doing the composite. The burr was so, blunt that instead of creating a hole, it created a big ditch. It slipped right across,
Gosh. Yeah.
and your instant response is shit. It's
Bad
done.
one. Yeah.
Yeah, it's a bad fail. But on that particular day, I was like, it's okay. It can happen in the clinic. Uh,
Hmm.
How I can improve and correct that and still give a beautiful restoration is what would, you know, make or break the case for me.
And that
And
this is on the day of the exam you're talking
day
about.
of the exam,
Exactly that happened.
first task, I just started the exam. It is within the first 2 minutes.
Yes. So this is so important how you control your anxiety, because the
Yeah.
first instance this happens and it can go really wrong from there if you're not able to control your panic.
My instant reaction was, shit, I'm done.
Yeah.
And I was like, I'll have to give another attempt. Or should I give another attempt? Or should I,
Yeah.
do something to, for the examiners to see
Yeah.
that instead of there being some issues, he's done exceptionally well to cover it.
How beautiful is that? Yeah.
So I took it at the right way. I didn't panic. I was like, I'll give it extra 10, 15 minutes and make sure everything else looks so beautiful that they can't even see the problem.
Absolutely.
And I was blessed on that day that things went really well. It was an anterior restoration, and I was sure the minute the examiner looked at that, they wouldn't notice anything apart from what I've done.
Exactly.
So, the exam is fair in that respect. They want, mistakes do happen even when you're doing tasks which are being observed by the examiner. So
Yes.
you have a, section of the exam which is called as Skildowski, where the
Yes.
examiner is right over your head. Now, what happens a lot of time, you do make a mistake, and instead of rectifying it, you think, oh, I've goofed it up.
Yeah. Now there's nothing,
There's nothing, and that is when you make more mistakes.
Yeah.
So when I came back from the exam, the first thing I did was give my English test,
Yes.
because I told my wife I'm clearing the exam, and I manifested it that way. So I gave my PT 4 days after coming
Yes.
back from Melbourne.
Yeah.
Done then dusted with PT,
Yeah.
and the results came and I passed. And
Yeah.
I truly believe in the power of manifestation now, because it is the way things work.
Yes, absolutely. That is so wonderful that you've talked about your entire journey, and not just the parts where, okay, you got the result. No, the story behind it is a lot more than what we see, right? It's the years of hard work, the decision making, the right decision for you, your family, that you have to make everything, and it's all worth it in the end. That's what I tell candidates when they call me. Should I be giving this exam because I am a I have my own practice, and I've been practicing for 10, 15 years now, and I'm in my 40s, and I think it's all worth it. It's all about how badly you want it. And like you said,
True.
manifesting is what changes the game. So, all right, we've given the exam, we've got our results, we're all happy now. How's the life been ever since you cleared the exam? Because another inquiry that I get from a lot of people is, it's all right. What happens after clearing the exams? How do I get a job? And is it, like they have enough jobs or not? And
Oh
look,
my
I
God.
know you and I cannot talk on behalf of a lot of, people. We're not taking guarantees here. We're just sharing your experience.
Yes. All right. So the Australian job market, when it comes to dentists, there is no dearth of jobs. Okay. If
Okay.
you've got the right skills,
Yeah.
all right, or if you got the right attitude, even if you don't have the skills, okay,
Yes.
maybe you're a recently past graduate,
Absolutely.
okay, even if you don't have the skills, but you have the right attitude. By
Yes.
right attitude, I mean being a team player,
Yeah.
being dedicated towards your work, compassionate,
Yeah.
empathetic, and you have that zeal to learn,
Yeah.
you can flourish in Australia.
Oh, those
All
are.
right. It's not only about money.
Hmm.
Okay. Your driving factor towards coming to Australia should be better quality of life.
Hmm.
There's nothing missing in India. Okay.
Yeah.
It's a beautiful place. I'm not taking things away from it.
Yeah.
It's given you a beautiful life. Things are good in India for a lot of people.
Yes.
But as dentists, especially for people who are not able to spend a lot of time with their families,
Yeah.
they are frustrated by long working hours, or they are frustrated by longer commuting hours.
Yeah.
So from traveling from point A to B, if you're taking an hour each side,
Yeah.
and by the time you come back home, it's 10 o'clock, 10:30 at night, you just kiss your kids good night rather than seeing them or playing with them,
Yeah.
then you should definitely pack your bags, give the ADC exams, and move to Australia. It's a beautiful country, and the biggest advantage which I would say is nobody would bother you after the clinical hours.
Yes.
Nobody would give you a call and would be like, Dr. Saab, there is pain in
Yeah.
one of the tooth.
Yeah.
And can you come over and do something, or can you prescribe a medication for?
It's actually, we've made ourselves so accessible back in India that, people are ready to call you at any time and all of that. But there's a certain amount of respect and privacy which is
True,
here. And, this all you learn from experiences when you're working here, like how
true.
professional things are. So,
Things
yes,
are.
I agree with you.
Yeah. And you get to spend more time with your family. You learn so many new things. You can pursue your hobbies.
Yes.
That's an endless, and
Yeah,
you
absolutely.
can you can enjoy your time without being guilty about it, without feeling
Absolutely.
guilty about it.
Pursuing, I would like to talk about it. Pursuing your hobbies, I don't think, we would talk a lot about it when we are working in India, because where is the
True,
time? But here, at least if you're doing good work and decent work and, you don't come back home with that stress. I'm not talking about, every dentist out here, everyone's different, but that's what I'm sure your experience and my experience has also been. So
yes,
I agree with that. And finally, Dr. Shashank, because you are an inspiration not just for me but for a lot of people who you have taught, and of course, you have to talk about any tips and any not even tips, actually words of wisdom or advice to not just new grads who are uh, planning to take the dive and give the ADC exams, but also to seasoned practitioners like you had been and you still are, who plan to quit their practice and start afresh, especially people with children and,
yeah,
couples. You and your wife, both are dentists. Me and my husband, we are both dentists. So we understand the struggle of a couple as well. We've got to be very, I believe, the partnership has to be great, the support system
true,
has to
true.
be immensely strong. So what is your advice to all those people who want to give this exam?
See, first and foremost is you have to dive into 100%. You can't be partially committed towards it. I've seen people who are trying to, sail two boats at
Yeah.
the same time. They are thinking, oh, if this does not happen, I have this life here.
Yeah.
All right. So if you have something to fall back to, things, you don't give your 100%. That is what I believe. So if you are thinking about pursuing this journey, it is a journey and there will be hiccups on the way. It wouldn't be a smooth sail. What you need to do is you need to have the determination, that dedication to see yourself through. All
Yeah.
right. You need what I would suggest is not sacrificing everything towards
Yeah.
the exam.
Hmm.
Having a family life, a balanced life, being yourself, keeping yourself mentally and emotionally strong
Hmm.
would sail you through. Okay.
Hmm.
So you have to plan this exam. You have to think long term. All
Yes.
right. It requires that kind of dedication
Yes.
and commitment from you.
Hmm.
So you would, after first attempt, if you say, oh, I didn't clear, I didn't do well, let's go back. Okay. Let's go back to the way things were.
Yeah.
You're not being true to yourself. You
Absolutely.
are just surrendering to the,
Yes.
situation.
And that
You need
first
to,
blow, sorry to interrupt you, but that first blow, because you've gone through it, and many people, I tell, in fact, people who call me for inquiries and for, enrollment, they often say that, we've seen people, clearing this in multiple attempts. Like, is it very difficult? And I tell them it's not, it is difficult, but it's more stressful. So if you know how to manage
yeah,
that, I've seen
true.
seasoned practitioners, the best dentists also taking multiple attempts. So don't take it upon yourself that how
Yeah.
did I not clear? Sorry.
Yeah. It's not about ego. It's about when I didn't clear the first time. I know out of 16 stations, I cleared 15 stations, and people who passed cleared 13, 14 stations. And I was like, am I being fooled here? You
Yeah.
know, that was my thought process. But then I realized maybe, overall, they were much better than me.
Yes.
Maybe it was just one station,
Hmm.
but for them, maybe they were average in most of the stations, but they were consistently average.
Yes.
And that is what you want. You don't want to be best in one thing and other stations and other places you want to be, below average.
Absolutely.
So you have to keep pushing yourself, keep motivating yourself. I knew, what I did in the first exam was what they really wanted. It's just I need a little more push.
Yeah.
And that is what I did during the second attempt. Didn't make any changes in the way I practiced.
Yes.
Rather, I was much more casual, to be very honest. And you know that.
Yes.
That was my approach. That
Yeah.
I'll be more, I will behave more like a clinician rather than a person who's taking an exam.
Yeah.
And that worked.
No.
So give yourself time. Listen to mentors. And when I'm talking about the mentor, I would want to tell you, choosing the right mentor is very important.
True.
Okay, you need to personally connect with them, see whether your wavelength match. There are X number of mentors,
Yeah.
or so-called mentors in the market, but you need to see who wants you to succeed,
Yes.
who will be there standing side by side, helping you achieve the goal you have in your mind.
Yes.
Okay, you can't go with a mentor just because the name is reputable. It's a reputed name, but they are not doing anything personally to see you through.
Yes.
It's like, and don't believe in, I would strongly say, don't believe in fear mongering.
Yeah.
A lot of people think the more fear you create,
I agree.
yeah, so don't believe in that. It's a difficult exam, no
Yes.
doubts about it. It's one of the most difficult exams.
Yeah.
But with the right amount of tutoring,
Yes.
right amount of mentoring, and the right spirit and the right motivation and the right attitude, you will surely be on the other side.
That is indeed very motivating, Dr. Shashank. I can't thank you enough for taking our time on a weekend. It's funny when we say this because when I moved here, everybody was asking me, how was your weekend? And I was like, what am I supposed to do, especially on a weekend? Coming from India, that we had these thoughts in our mind, like every day is the same.
Yes, true. Weekend is special. You can't, Friday evenings is the most wowsome,
Exactly.
day.
So I will let you now enjoy the rest of your weekend with your family, but I want to, say a big thank you for taking out your time and saying these words. And I'm sure when people will listen, they can relate to you and relate to the entire journey that you've, put out there for them. So I will see you again. Thank you so much, Dr. Shashank.
No worries, Dr. Henna. Have a good day.
Thank
Take
you.
care. All the best.
Bye.